I had a kid present to the emergency department with difficulty breathing, and I got called into the room, and he was sick. He was working really hard to breathe. He had retractions. He had nasal flaring where his nose was flaring out. You could hear him wheezing from the door. He looked anxious and uncomfortable. And so I was like, yep, let's go. Let's get some albuterol. Let's get some steroids going. Let's get him on the monitor. So everybody's doing all the stuff. So I turn and I talk to mom a little bit to get more history. She says he has a history of asthma. He's been breathing hard for a couple days, but today things really got worse. Did a dose of albuterol, with the nebulizer at home, and it didn't seem to work. He didn't really seem to get better with that treatment, so she decided to stop giving it to him. When kids have asthma, there's a couple different things that happen to their airways. I don't have asthma, so my airways are nice and big and open like this. But when people have asthma, they have some baseline inflammation, so those normal big open airways are a little bit smaller already. And then when they get sick, or they're out in the cold weather, or they have allergies, the airways start to spasm closed, and that's called bronchospasm. And albuterol helps open up that bronchospasm. But sometimes you do need some steroids to help decrease that inflammation as well. And so in the hospital, when you have an exacerbation, we do usually oral steroids or IV steroids, dexamethasone, solumedrol, prednisone. We also do daily inhaled steroids that treat that inflammation topically with an inhalation like fluticasone or something like that. If you give an albuterol treatment and they're still really struggling, it's probably time to head to the emergency department because they need more albuterol and likely escalation of their care. If you don't have one, your pediatrician or pulmonologist can help with an asthma action plan, which is a protocol about what to do when your kids are having problems with their asthma. If your kiddo is struggling to breathe, you're giving really frequent treatments, or you have other concerns, it's time to head to the emergency department.